After their claims are processed in detention, then they get released to us. Some of them arrive with upper respiratory problems, nausea or vomiting, and some of them come with very few cases of chickenpox, which require isolation, but not necessarily higher level of care to a hospital or an emergency room. There have been some kids that were admitted in order to be treated for their conditions, and they spend an average of 1 to 2 days in the hospital, and then they get released. So it's the period of detention that they don't receive proper nutrition and hygiene. So they come over not having bathed for 3 or 4 days, however many days they've been in detention. The consistent story is that they're only fed juice, frozen burritos, and peanut butter crackers for every meal. They are very resilient. They're not coming over with pre-established conditions. They were healthy where they were. Many of them have received their vaccinations. So the narrative that they're bringing over diseases and exposing us to all kinds of things is not because they're bringing them with them, is because of the situations that they're encountering either at the border or in detention. We have been very cautious and very diligent of making sure we have proper staffing, clinical staffing, to make sure that we meet their needs upon arrival and not wait until something gets worse. So that initial triage and assessment that happens after they get off the bus is critical, because that's when we identify people who, especially kids. Kids can feel kind of so-so 1 hour and then the next hour go downhill.